I'm laying in a dental chair, having wisdom tooth out. The surgeon is putting pressure on my tooth, and all of a sudden I hear a snap, and then a, oh. Actually, he said something else, but I can't repeat it. Then I hear, ever hear a concrete drill? I realized years later that was closer to the truth than I realized. And then snap and snap. Then they take the towel off my eyes. Ted, are you doing okay? Well, you asked that question. I mustn't be doing okay. So I start passing out. So all of a sudden there's steps all over the place. There's a wet washcloth across my forehead. There's ammonia in my nose. And then we had to finish the procedure. I learned just a few years ago that by looking back at what I'd done as an oral surgeon myself, God knows why I did this, but there turned to be a purpose behind what happened and what happened consequently. I figured out how to eliminate every mistake that I had made in that experience. Number one, waited too long. I ended up with an infection because the tooth had come partway through the gum. You know, the swollen gums and the pain, and you lose a week on antibiotics before the pain goes away. Then you start getting the tooth out. Number two, I only had one wisdom tooth out. 45 minutes to get that one wisdom tooth out. I did it awake with local. I realized later that in putting a patient to sleep, you not only allow them to not experience a difficult procedure, but they don't remember it. I remember this experience for 5 decades. A long-term memory? Yeah. Next thing, as X-ray technology improved, using a 2D X-ray, well, let's demonstrate. Here's my roots, growing, 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 growing. Well, from this angle, they look nice and straight. But use the CT to look at it 3D, they're not so straight. Houston, we got a problem. I can guarantee you at least one of those roots is going to break, just like mine did. Great time. I developed an anesthetic that, well, the reason I did my surgery, had the surgeon do the surgery, awake, was because I heard that going to sleep will make you sick to your stomach. And as an oral surgeon, if I had a patient get sick to their stomach, I'm gone. I'm out of the room. So I had multiple reasons to figure out how to make this anesthetic a better one. So I refined the anesthetic. It's more like a nap, and they don't have that memory. Dry sockets. If you go to a surgeon and the surgery takes you 20 minutes, like what I was doing right out of residency, I was good. 20 minutes, I can do a set of wisdom teeth. Well, guess what? The next week, they're coming back. Oh, doctor, it still hurts. You got to do something about it. I need more narcotic medicines. Well, you're putting in an awful tasting dressing to get rid of the pain that cauterizes, it burns the bone to get rid of the pain. The taste is awful. This goes on for a couple more weeks. I figured out how to eliminate that too. I haven't seen a dry socket in years. Better way to do it, isn't it? So, at this point in my life, I've decided that I want to put together everything that I have learned to decrease pain after surgery. And there's more than one. I can't go into all the details now. But the point is, I can do this, but I have to do it for those who can afford to do it. So I do it as a concierge service. Insurance is not going to pay for it. I can't afford to finance it. So by doing VIP wisdom teeth concierge services, I can throw everything in my bucket into getting them the best experience they can have. Yeah.